Good morning and welcome to mmlearn.org Ask the Geriatrician program. You're at the Elizabeth McGowan Training Institute, and this is a presentation that is brought to you by a program of Morningside Ministries. We are so glad that you could join us this morning, and we're very excited about our program today. Before we begin, I want to give you just a few thoughts, and I'm going to run through those. I know many times while we're watching these programs you'd like to ask a question or make a comment, and we love having those, so please do that. You can do that by clicking on the Ask bubble that's right above the video player, and there's an arrow pointing to it for you. Or at any time, we want you to feel free to phone in your question, or you can text questions to us as well. That number is 210-889-1285. Let me give that to you again, 210-889-1285. Or just click on that bubble and email us a question. It comes right through. It'll be very simple. Try it because we love hearing from you and having your questions. Sometimes during a program we do have technical difficulties, and we know that happens on your end as well as ours. Should that happen, remember that this program is available usually just within an hour or so after the presentation on demand. And if not, it's always up within 24 hours, and you can always send this to others or watch it again. So no matter what happens during the day, it's still available to you. It's so important for us to know what you think, and that's why we ask you to complete a survey. At the end of the program, you'll see that exact same designation for survey, and if you'll click on that in the upper right-hand part of your screen, it says less than 5 minutes, but I'll tell you it only takes 2 minutes. It makes such a difference because it's what allows us to know what you're thinking, what you'd like to know more about, as well as for our generous donors to continue to be able to fund these programs and make them available to you. Today our program is on emergency room or urgent care, a caregiver's decision. And this is brought to you by the Patient Institute, and we're so delighted to be able to thank them for doing that for us today. We have some wonderful presenters, and we're very excited. Linda Ratner, a registered nurse and the owner and operator, CEO of Impact Urgent Care, is with us today to answer any questions that you have. And Evan Ratner is the physician, owner, and medical director of Impact Urgent Care and has lots of great information to share with you. So, Evan, we're delighted to have you with us and look forward to lots of good questions from you all. So, thanks very much, and I'll turn it over to you.
Thank you very much. Well, today I'd like to discuss a little bit about what the decision-making process should be between deciding to go to the emergency department or deciding to go to an urgent care facility. Urgent care is a fairly new segment of the medical community, and it has really started to fill the void between primary practice and the emergency room. I think ideally it will help to unload some of the crowding issues and overcrowding issues in the emergency room, but there are some things that are still appropriate to go to the emergency room and some things that are appropriate for urgent care. Typically, the emergency room is about as complete as it gets. You have complete radiology services that would include regular X-rays, CAT scans, MRIs, ultrasounds, and so this imaging is available immediately, and that is one of the biggest advantages to any emergency room or any emergency department, that these types of advanced imagings are available, and they're also read by radiologists. There is also a complete laboratory service available in the emergency room, and that's usually associated with a hospital, so any type of lab test that you need, whether it's regular electrolytes or a blood count or cardiac enzymes or even some more rare tests, are usually available, and typically they're available during the emergency room visit within a matter of minutes to hours. Also, in the emergency department, there is very quick access to specialty care, and in the emergency room that would be called an on-call list, and that would include specialties such as internal medicine, even family practice to do admissions, infectious disease specialists, cardiologists, orthopedic surgeons, general surgeons, neurologists, and when a patient needs to be admitted directly from the emergency room, typically the emergency room is not the admitting physician, and any kind of specialty services will be arranged by the emergency physician in the emergency department. There are also certain hospitals that offer certain specialty services, whether that's a transplant hospital or a hospital that has in-place, in-house psychiatric services. Those things are also to be considered, and not every emergency room might have the ability to directly admit into their own hospital for those services, but there are transfer agreements, and we're able to admit to specialty services as well. With this 24-hour access to as complete medical service as you can get, there also comes a higher cost. And the cost of having a CAT scan available at 3 o'clock in the morning, and the cost of having lab available at 3 o'clock in the morning and having instant access or access within 30 minutes to a specialist is pretty expensive. And the cost of all this is shared over the entire emergency room population. So it's no different than if you need a plumber at 3 in the morning, it's going to cost you more than if you schedule an appointment for your plumber to come out in 2 or 3 days. What urgent care offers is really something a little bit different. Most of the patients who present to the emergency room really don't need to take advantage of all those advanced imaging and laboratory services and specialty services on an immediate, right now basis. And urgent care offers us the ability to present and to give those type of services on somewhat of a less urgent basis. So it can play an important role in the community by letting people get taken care of outside of the emergency room, and that will help to decrease the wait times in the emergency room, and it'll also get that patient faster service. Generally speaking, certified urgent care will offer regular X-rays. Sometimes it may offer ultrasound. There's usually laboratory available, and that laboratory is usually limited, but we can do things such as CBCs and electrolytes and kidney function studies, and depending on the urgent care and how complex the lab is, it's certainly not uncommon to have the ability to do cardiac enzymes, checking coumadin levels in labs in that venue. In the urgent care setting, we can also do procedures. If there's an abscess, we can drain abscesses. We can reduce broken bones or set broken bones. And even some of the more complex urgent cares can perform procedures that even include conscious sedation. So urgent care is an opportunity to have these services done in a setting outside of the emergency room, and that would also include things like bumps and bruises and laceration repairs as well. The typical urgent care is not available on a 24-hour basis, so that 3 a.m. visit really limits you, and it may end up being the ER just because that's the only thing open. But if it can wait, most urgent care has extended hours. 8 in the morning till 8 at night is not uncommon, sometimes till 11 o'clock at night, and typically it's open 7 days a week. One nice thing about urgent care is that, generally speaking, the wait times are much less. A nationwide survey of urgent care has shown that somewhere between 70 and 80% of patients are in and out within about an hour in urgent care. And so that makes for a little calmer environment. There's not ambulances arriving. There's not people yelling and screaming. So it can tend to be a little bit more pleasant, a little bit more restful, a little bit calmer experience in general. The physicians and the staff in the urgent care will also tend to be more routine because there's less shift work. And so even for some people who will use urgent care on a reoccurring basis, you can get to know some of the staff at that facility, and that would include the physicians and the nurses and the staff as well. So when we decide what we need to go to the ER for and what we need to go to the urgent care for, we can look at some of these examples. And generally, if someone is having an urgent life-threatening condition, that needs to go to the ER. And so a suspected stroke is something that absolutely, positively should go to the ER. It's something that we can do things about now, but it's very time intensive and related, and we want to get that treatment started as soon as possible. So you don't want to delay things by putting in one middle step by going to the urgent care first. Cardiac arrest or heart attack. That's something that should go to the ER because those patients are going to need to go either to surgery or to the cath lab or be admitted to the intensive care unit, and that's something that they're already there. Typically, if you have to call an ambulance for a problem, that problem needs to go to the emergency room. There are a few examples where people who have had chest pain and are having a heart attack will present to the urgent care, and under those circumstances, the urgent care, depending on the urgent care, might have the facilities to help diagnose that and help transfer the patient to an inpatient bed or to a cardiac cath lab in a very time-efficient manner. Severe traumatic injuries, if you are trimming your trees and you have a horrible chainsaw accident gone bad, that's the kind of stuff that needs to go to the emergency room. You need the access to the IV medications and the surgeons who are going to reattach that limb for you. So really anything that's going to require urgent surgery in your mind is probably better off going to the emergency room. Overwhelming infections. For people who have had an infection and it's been brewing and they are weak, they can't even stand, they've had high fevers and they're really looking bad, that can sometimes be sepsis. That is a real life-threatening condition and usually requires an admission to the hospital. And so again, that's usually best taken care of in the emergency room. So a lot of injuries, though, don't really require an ambulance or EMS. And if that's the case, if it's a broken bone, if it's a sporting injury, if it's a bad cut on your leg or laceration, those type of things that you would drive to the emergency room can also usually, you can drive to the urgent care. So these type of things, such as bruises and sprains and strains and cuts, are taken care of in most urgent cares. And again, because of the setting, because of the comfort and the timing, usually these things can be taken care of much quicker and also a lot more efficiently and a lot less expensively. Upper respiratory infections, I'm not sure about the rest of the country, but here in Texas it is definitely allergen season. And so coughs, colds, runny noses, sinus infections, these are things that are usually best taken care of in an urgent care setting because the wait is a lot less. You don't have to sit around in the waiting room with a lot of other very sick people, and you can get taken care of quickly. The likelihood that you need to be admitted to the hospital is low, and so it makes sense to take care of this in an urgent care setting. Things such as rashes or allergic reactions, burns, these are things also that for the most part can be taken care of in the urgent care setting. There is one exception. If someone's having a really bad allergic reaction and that requires an ambulance being called, I would say go to the emergency room. There are medications that can be given, and in the worst case scenario, if a tube needs to be placed to breathe for someone, the support for that once that tube is placed really only exists in the emergency room and in the intensive care units, so that patient would really need an admission. Uncomplicated chest pain. That's a really tough one. It's hard to determine what's uncomplicated and not uncomplicated. Is it just some chest soreness from a cough, or is it from a cardiac problem? Is it from pneumonia? There are a lot of things that can cause chest pain. And the rule of thumb is there's really no rule of thumb. If you're feeling really sick, if you're feeling like you're going to die, if you feel like something is catastrophically wrong, the better place for you is the emergency room. And that's really one of the few complaints that will almost never leave you waiting in the waiting room, and that will get you seen quickly. In an urgent care setting, and sometimes younger people or people who don't have a lot of concurrent medical problems, chest pain can be evaluated. And even in patients who do have some medical problems, again, if they're not feeling like they're going to die or something's horribly wrong, urgent care is a reasonable place for initial evaluation. One special thing that urgent cares can do that I think really are a much better alternative than the emergency room are some exacerbation of chronic pain conditions, such as migraine headaches. Some emergency departments can be pretty loud, the waits can be pretty long, and when they come in, sometimes the focus is getting people feeling better and getting them out. In urgent care, depending on the urgent care, you can set up protocols with some of the pain management specialists to give intravenous medications to help manage these acute episodes of pain. And even though it hurts a lot and people are very uncomfortable, it's probably not life-threatening. And so the urgent care setting can really be superior for these type of special complaints. Routine things, trouble urinating or urinary tract infections, routine immunizations, including tetanus shot, meningitis, flu vaccines. These are perfectly appropriate for urgent care. And in fact, most emergency departments won't have much in the way of routine immunizations beyond a tetanus shot. There is some things that urgent care also can do which is absolutely outside of the venue of emergency rooms, such as travel medicine and immigration exams. And there are some urgent cares that have weight loss programs and smoking cessation programs. But again, that will vary a little bit on the urgent care itself. There are some other specialty programs such as sports and concussion management that are perfectly appropriate for an urgent care visit and usually are not offered in the emergency department. But it's important to understand that while most ERs are the same, that they have ER physicians, they have an on-call staff with specialists such as cardiology and orthopedic surgeons, they have the lab, they have the X-rays and the CT scan and the MRI and the radiologist. And so for the most part, any ER across the country will offer similar services. The same cannot be said for urgent care. And there is really a wide spectrum of the type of services offered by urgent care. There are some urgent cares that are staffed by nurse practitioners, some that are staffed by physician assistants, some are staffed by physicians. The personnel giving the medications can range all the way from a medical assistant to an LVN or an RN. Radiologist services can be provided either by licensed radiology technicians or very limited technicians. And the staffing really varies from urgent care to urgent care. So as we look at some of the differences between different urgent care facilities, some of the questions that will come to mind and that you might want to get answered are the X-rays taken by a licensed radiology tech? Are they digital X-rays? Are they reviewed by a radiologist after the urgent care physician has seen them? Are the medications administered by an MA or by a nurse? And is the facility certified? One of the questions that you want to ask of your urgent care and how you want to prepare yourself is perhaps look around, see which urgent care is around you, and call them to see what kind of services they offer. If they only offer caring for sore throats and really uncomplicated issues and perhaps have some programs as weight loss or smoking cessation, those are not places that you want to go to if you have a bad laceration or if you have a broken ankle or something else, or for you an evaluation of those. If you call ahead of time and you find out that they do have either experienced family practitioners with trauma experience, or these days a lot of ER doctors are staffing urgent care, and they have radiology technicians and they can give IV fluids, you may want to know that ahead of time so that you can use that information when you decide whether or not you want to go to urgent care or an emergency department. So there's a wide range of the specialty and the services offered by any urgent care center. And most urgent care would really like to work with your primary physician, and there is no replacement for your primary physician. This is a physician who knows you, who's taken care of you for a long time, knows some of the ins and outs and some of the special things that they need to know about you. And urgent care should coordinate with your primary care physician to make sure that you're getting the services that you need and be able to communicate back and forth with your primary physician to make sure that there's continuity of care and that the things and the services that you're receiving will be, your primary physician will be informed of that. In trying to make the decision as to where you should go, whether it should be an emergency room or urgent care, think about whether or not you think there's a high likelihood that you need to be admitted to the hospital right now. Think about if there is a high likelihood that you need a specialist right now. And if those things do not exist, if they are urgent but not necessarily imminently life-threatening, urgent care can be a very, very useful alternative. It can be conveniently located, and again, it can be a lot calmer, a little nicer therapeutic environment, and certainly a whole lot less expensive. But you need to do your homework, and making a phone call or stopping by an urgent care center before you actually need one can go a long way to know what services they'll provide and whether or not you can go there or to an emergency department. One other question you should ask of the urgent care facility is what insurance they take. When you present to the emergency room, for the most part, everybody needs to be evaluated. In an urgent care setting, that's not often the case, and knowing what insurance is accepted by an urgent care facility will help to mitigate any problems with payment or cost associated with that visit. So I see now that we have some questions and answers. And the first question that I have is, how many doctors are there in an urgent care facility? And the answer is simply that depends. There are some urgent care facilities that see well over 100 patients a day, and they'll have several doctors. They may even have several doctors and what we would call extenders, such as nurse practitioners or physician assistants, so that they can see the patients in a timely fashion. There are a lot of urgent care facilities that are able to see their patients with just one doctor on at a time. Another question I see is it common to have a pharmacy in an urgent care unit? And that answer is also, it depends. State by state, there are different regulations as to what different facilities can provide. And for example, in Texas, an urgent care can't really dispense medications the way a pharmacy can. That's not true in other states. So again, forewarned is good. Call your urgent care and find out ahead of time if that's a service that they offer. Another question. I took my mother to an urgent care facility, and they were wonderful. Thank you. Well, you're welcome. I think it's good, and I think as more people have good experiences in the urgent care setting, that their real value can be recognized and taken advantage of. Another question. Can I expect prescription refills? The answer is yes. It depends on the condition. For example, if someone comes in and they have an allergic rhinitis, or if they have a runny nose and have a lot of congestion from some of the allergens from allergy season, a lot of those will require treatment for several months. And those type of medications can be easily refilled from an urgent care facility. There are some medications that you shouldn't expect to be refilled from an urgent care facility, such as chronic pain medications. As more and more doctors prescribe chronic pain medications, it can get a little confused, and patients can have bad results from too many medications or too many similar medications prescribed. So generally speaking, those won't be refilled, but blood pressure medications, even diabetic medications, certainly cough, cold, sinus medications are medications that can be pretty commonly refilled from an urgent care setting. Do you use a nurse practitioner or a registered nurse? In our facility, we do not have nurse practitioners. We have RNs and we have LVNs. There are some facilities that are staffed primarily by nurse practitioners, some that are staffed by physician assistants, and there are some urgent cares that will have physicians and nurse practitioners and PAs as well. So that really varies. Do you give the shingles shot? The answer is yes. The shingles shot, if I could say that 3 times fast, is not always available. Sometimes there are some shortages of the vaccine itself. If you want the shingles shot, I would absolutely positively recommend calling ahead to make sure that it's stocked and that the vaccine is there. Another question, can I get a second opinion from my primary doctor by an urgent care doctor? I'm not sure exactly what you mean by that question. The role of urgent care is really not as a second opinion. Typically, a second opinion will come from a specialist. And so if you're having chronic pain in your hip, depending on what your primary practitioner has done, if they've done some plain X-rays or gotten a CAT scan or possibly an MRI, reviewed that with the radiologist, started you on a course of treatment. Typically, if you want a second opinion, you'd be seen by a specialist or an orthopedic surgeon. Certainly, there are people who come in who've seen one doctor and been started on a course of treatment, and they're not feeling better, and we'll evaluate them as well. But in the classic sense of second opinion, we're not specialists, we're not orthopedic surgeons, we're not cardiologists, and we're a lot better at doing the initial evaluation and initial therapy and temporizing treatments than we are. I think you'd be hard-pressed to find an urgent physician or even an emergency physician who's going to second-guess your cardiologist about what's causing your cardiology problems. And I know that's a nebulous answer, but I hope that helps. From Sandy, what is the real difference between facilities that are staffed by physicians or nurse practitioners and PAs? Well, the real difference is what they're able to offer. As healthcare is changing in this environment, we're seeing more and more physician extenders. And these extenders are perfectly competent taking care of a lot of different things. My personal opinion is that narrower focus works better with physician assistants and with nurse practitioners because they can get a real expertise in a little bit more narrow field. I think that the real difference between having a facility with just nurse practitioners and physicians is the level of care that they can administer. I think it's very unlikely that nurse practitioners are going to start intravenous medications on people and do complicated treatments such as evaluate chest pain and read X-rays of the chest, give intravenous medications, breathing treatments. A lot of times they will bump that up to a more complex facility, whether it's the ER or sometimes even in our case we'll have some of these facilities refer patients to us because they know we can provide these type of services. So if there's a physician in the facility, an experienced physician in the facility, the depth of services offered can really extend way beyond what a nurse practitioner can offer. How does an urgent care address issues specifically experienced by the elderly? That's a great question. And some of the concerns, some of the needs by some of our older patients are very different from adult patients and even pediatric patients. And so you need to have a little bit more complexity and experience to deal with some of these issues. And these can include subtly managing blood pressure issues, being a little bit more aware of when a sinus infection isn't really just a sinus infection, but it's extended down into the lungs and has become a pneumonia, and how medications that are prescribed are going to interact with other medications, as unfortunately as we tend to get up and have a few more years under our belt, we also tend to have a few more medications. So knowing how medications interact is a big part of taking care of some of our older patients. And I think a physician has more experience with that than necessarily a nurse practitioner. So some of the differences that are real have to do with just the experience of the personnel at an urgent care center, or I think as we talk about comparing to an emergency room, the level of staffing with physicians and the nurses that are there are pretty consistent across the board, but not as consistent across the urgent care board. I don't see any further questions at this moment. I would like to thank everyone for taking the time to listen, and I hope that I provided some answers to some of the questions that you may have. And if I can just provide a quick synopsis, it's that if you feel you have an urgent or imminent life-threatening problem, if you need to call an ambulance, you're probably better off going to the emergency room. If you feel it's not imminently life-threatening, you don't need to call an ambulance. Urgent care can oftentimes be a lot faster, more pleasant, and more economical alternative, but do yourself a favor by exploring the urgent cares in the area, the ones that you would consider using before you go there. You don't want to show up with a problem that they're just going to transfer you to the ER for. So a simple phone call or stopping by and saying hello can really help you in your mind to really localize and to understand the services that are offered.
Dr. Ratner, thank you so much. We are so appreciative. This has been a great presentation. We are always grateful that we get the opportunity to learn more, for people to come in and share this information with us. And I have to just share with you that I think from the view of working with seniors and the programs that we have for you as caregivers, we're always trying to reduce the amount of stress on your families, and if an urgent care meets that need, takes away some of the stress of an ER and all the confusion, especially when you have people with cognitive impairment. This is a wonderful alternative and very meaningful to you and your family member. So that's very exciting. We're going to switch over right now. And I just want to extend my appreciation to all those from the Baptist Health Foundation, Methodist Healthcare Ministries Foundations, Southwest and Central Consortium of Geriatric Education Centers of Texas, the Prior Trust, and many of you individuals and organizations that support the mission of mmlearn.org to allow us to bring these wonderful programs to you, and people just like you. Thank you. Remember again that if you want to access any resources, you can do so. I encourage you to still continue to send in questions. Dr. Ratner and his team are more than happy to answer your questions, so if you'll send those, we forward those on and we'll get an answer to you, and usually within 72 hours or less. So do fill out and send in those questions. The other thing I want to mention to you is in the upper corner there is also a way to email this to your friends, this program. So forward it on and let other people know about this and learn from it. Just a reminder to please fill out that survey for us, and to know that this program is going to be available on demand 24/7, so encourage other people to watch it and to learn. Just a moment to tell you 1 second that's something very new from mmlearn.org, and that's our virtual caregiver fair. It's really great to bring incredible information to all of you, but not if you don't know where to access it. So we've been trying to offer a new service, and that is some place that you can go on our website to find out more about the programs that are offered, or more about organizations that offer services and care for those older citizens. So if you'd like more information on that, just email us at www.info@mmlearn.org, info@mmlearn.org. And if you would like to request any materials or any more information from us about today's programming, again, there is our contact information. We always appreciate that you've joined us. We thank you. We look forward to seeing you at our next presentation of Ask the Geriatrician.